Hey, Dr. McNamara here, and I'm going to talk a little bit about degenerative joint disease, or if it's in the spine, it could also be called degenerative disc disease, but it can only be called that in the spine. So, what starts to happen as we age or experience trauma, life happens, and we got gravity bearing down on us all the time, we start to get changes in our bodies, and they're known as degenerative changes. Now, the reason this happens is because the body wants to protect itself. We have one of the most important organs in our body, the spinal cord, that is lying in between each vertebra, and the vertebrae are designed to protect that spinal cord, so we can be alive and move and do all the things we love and enjoy. The problem is the body doesn't always understand what kind of traumas and stresses that we are facing in the outside world, and instead of helping us, sometimes it can actually hurt us. So in the process of degeneration, we'll start with a normal healthy disc or healthy lumbar spine. So from this model, you can see a nice big thick lumbar vertebrae, a nice big thick healthy disc. It's got a lot of bounce to it, and then another one underneath. We can look at these structures in the back. There's nicely defined joint lines. Everything is crisp, and the bone is clearly defined. Now, this is a pretty severely degenerated lumbar vertebra here, and we can see it from this model. So one of the first things we notice is that disc, or that, not the disc, well, the disc height as well, but the vertebral body height starts to shrink down. So you can see clearly that these vertebral bodies are not as tall as the other one. And then another thing we also start to get is these little bony osteophytes. We call them bird beaks sometimes in our office because they look like a little bird beak trying to, nibble on a little bit of food over there. The problem with these things, again, it's a protective mechanism that our body does in order to stabilize the joint so we don't irritate it more and create further injury. But a lot of times it causes different dysfunction, segmental dysfunction, and symptoms of pain that a lot of times we cannot treat unless we reintroduce movement and get the joint functioning properly as it normally would. So I like to say in our office to our patients, the best thing for a joint is movement. If you want a joint to die, just stop moving. If you want it to be healthy, then you got to move, and you got to move in the correct way. So what we do in our office is, if these vertebrae aren't moving the way they properly are supposed to, and you get these degenerative changes, all this calcification, these osteophytes starting to form, all those bird beaks, we want to induce the movement for keeping it to progress even further, because there's no reverse button on this, but we don't want to fast forward. We want to put the pause on it in order to remove the symptoms of pain and help the overall health of the joint. So what we do in our office is we mobilize joints, and then we work on specific exercises to keep the joints moving properly in the right planes of motion in order to prevent any type of further injury and to reduce any possible symptoms you may be experiencing now. So if you or someone you know could be suffering from any degenerative disc or degenerative joint disease, also known as osteoarthritis, come give us a call. We can check it out. We may want to take x-rays to see how far it is in progression, but we can definitely help reducing any type of symptoms you are receiving from any type of DJD or DDD, and keep it from getting any worse. So give us a call and check us out.